Welcome to the Board of Health, Wednesday, March 18th, 2026 at 5:30 or thereabouts. Pursuant to Chapter 2 of the Acts of 2023, an act relative to extending certain COVID-19 measures adopted during the state of emergency signed into law on March 29th, 2023. This meeting will be conducted via remote means and in person as long as members of the public can easily access the proceedings in real time and participate remotely. Until further notice, this meeting will no longer be broadcast live. It may be watched when the show is replayed on YouTube. Members of the public who wish to participate in the meeting may do so in the following manner. In person at the Rope Walk Room located on the second floor of Plymouth Town Hall. Note that the capacity is limited of the room and may reduce the number of attendees that can be accommodated. You may also join remotely by Zoom. The Zoom information is located on the agenda. You may also send any comments or questions that pertain to a current agenda item to publichealth@plymouth-ma.gov. They will be read on air and answered by the Board of Health as practicable. If time doesn't permit answers during the meeting, responses will be sent by email as soon as possible. Okay. So those in attendance, Dr. Hudson.
Present.
Kate. I think she said she. Now
I'm here.
here.
Sorry, I muted myself again.
Yes, and myself. Okay. We didn't have any meeting minutes, so no approval of the meeting. So I'm actually pleased to make an announcement. We have a new Board of Health member, formal Board of Health member now, who is Katie Marini.
Oh, nice.
Yeah, so she
Thank
she was our alternate, and now she's the Board of Health member. So I assume we'll be looking for.
Yes,
getting an
that's
alternate.
already, yes, that's already been in the works, but Katie, before we continue, did you get sworn in?
No, so I actually went to the town hall because I thought we were meeting in person at 5 for some reason. Nobody was there, but they leave at 4, so I'll go down tomorrow morning and do it.
Okay, she can't vote.
Can she be our alternate?
But she
She
was the
can't.
alternate. She
Isn't she
I
our
was
alternate?
appointed as the alternate.
Oh, her alternate?
Yeah.
Okay, that's good, yeah.
Yeah,
Okay,
yeah.
okay.
She's maintaining her
But she's
alternate
not an
position.
alternate anymore, though. By the vote of the select board.
Yeah,
She.
But was
is
that
no longer the
immediate?
alternate.
yeah, it is.
They're always immediate.
They're immediate.
I mean, it's fine. I feel like, as long as it's fine with you, Katie, that if you want to add input, but we still have a quorum without.
Yeah, whatever you
Without-
guys want to do. I'm sorry, I didn't realize that, but whatever you want to do is fine.
Okay.
Okay.
How do, okay. Yeah,
I
I would just be more comfortable
think that that's.
if she, definitely take part in any conversation, Katie.
Oh, sure.
State your opinion.
Yeah.
But when it comes to voting, I would just be more comfortable if it was just the three of you. Only because I think with the,
Yeah.
she was appointed, you know, yeah, no, as a full-fledged member.
Yeah.
Yeah, and we're posting the alternate position, so technically
Okay.
I would just be more comfortable with that.
Okay.
Thank you.
Well, anyway, congratulations.
Yeah.
Well, thank you.
So we will now have some septic variances.
The polystyrene.
Polystyrene is
usage
first.
first.
I have the wrong agenda.
Oh, here we go.
That's weird.
There,
Oh,
I don't
okay.
know, there's somebody as Peter and somebody as resident and
I
somebody.
think Charlotte
Okay.
is on.
Charlene.
We'd like to talk to Cushcone. Is Cushcone present?
Charlene,
Should be.
Charlene?
yeah, Atkinson should be representing Cushcon.
This was a request to postpone polystyrene usage.
Mhm.
Do you have to unmute her?
Charlene, you're gonna have to unmute yourself. Charlene, are you able to unmute yourself?
Okay, we might have to bounce back.
All right, so while
Okay.
we're waiting for Charlene, I do just want to say the person that is listed as resident, if you could at least, if you could either turn your camera on or change your name, that would be great.
I left.
Okay, this is going smooth.
Okay, all right, well,
Moving on.
let's do some septic variances. So, 78 Lakeview Boulevard. Are you here?
This was good timing.
Very good.
Okay, if I just put this here like that,
Yeah.
the right side up would be better.
All
All right, for the record, Scott Bernard with 3 Consulting, representing the applicant. So the applicant, just a simple septic affair. Existing dwelling, 5 bedroom septic.
No, stop just a moment until
Dr.
the
Reed,
silence goes.
Yeah. over here.
if you would like.
Yeah.
Those-
Right, yes, so we have a existing dwelling here. It's serviced by a couple of just pits, cesspools. So what we're proposing here is to put in a new septic tank and some concrete chambers. There are a few limiting factors on the site here, so there's a pond to the north, it looks like. Also, all the properties in this area are all serviced by wells, there's no public water. So as such, we're seeking relief for a few areas. We are able to stay far enough away from the pond, but we will be closer to the stone wall, closer to the lot line, and closer to some wells. And really, there's really no other room on site to put this type of system. It's all good material, it's all sand, and you're pretty familiar with what we're doing. So yeah, Captain, answer your questions.
So there's 2
So where
cesspools
will-
on the property now.
Yep,
They're being abandoned and will be filled in.
they'll be pumped through those, yeah.
And where are
Where-
the wells?
Where are the
Yeah.
wells?
That's-
Yeah,
It's hard to, we
I
have
don't-
trouble finding them.
All right, see what says existing dwelling, the well is in the corner, the upper left-hand corner.
there's
See the
a-
W, it says well.
And then up
So the
here.
existing-
go
the existing
straight up.
house- The existing house, or the house on the locust lot is actually right here.
Oh, yeah.
And the.
And if you go straight up from there, you'll see another
Right
one.
here.
Yeah,
right.
74 is over on the side of the property. It's actually, so there's no relief requested from this well.
is it just the locust well?
Exactly, yeah, thank you.
Okay.
Just.
Oh, okay, so just that one.
Yeah.
Oh, okay,
Yeah.
that.
It's in the house, it's in the garage.
Yeah, so we're seeking relief for the property line here, it's, 4.6 off the street line. And
Yeah,
the reason we're pushing it so far out is to maintain the setback to the above well. So we're really just looking for relief from the locust well.
What's what is the distance between the edge of the septic system and the next door neighbor's property line? Like,
5 feet.
So that's 5 feet.
fine.
I thought
Yeah.
the 5 feet was, okay, so thank you very much.
Yeah, so it's really from the neighbor's property line
Yep.
to the
Okay.
street line.
In the 4.6.
Yes.
and, do you know, have the wells ever been tested?
On the locust site,
Mhm.
I don't have that information, I'm sorry.
Okay. So generally, we do like to at least see that.
It
before
is
we start.
required.
Yeah.
Yeah.
Especially with cesspools.
Oh, yeah, right. Okay, and then, the abutters, any abutters? Anybody have any problems? Karen, what does the department feel?
The department would recommend approval, we'll need the well test for the locust well,
Sure.
not the abutters, because they're not impacted, so just the locust well.
Okay.
But with that, the department would recommend approval.
Okay. Any other questions? On the board? Can I hear a motion?
I'll make a motion to accept the plan as written.
Okay, second?
I'll second it.
Okay. So Amy has made the motion and Barry has seconded. All those in favor?
Aye.
Aye,
Katie?
she can't vote.
Oh, she can't vote. Oh, so it's the 3 of us. Okay. I vote yes.
Okay.
Okay.
Hello?
Okay,
Oh, that's
Hello?
Atkinson.
Okay.
Oh,
yeah.
okay, hold on one second. We'll be
Okay.
right
We're
with
having
you.
some issues, sorry.
Okay, we'll be right with you. We are too, everyone.
We are having
There's a gremlin around here somewhere.
we are having issues.
Thank you very much.
Thank you.
Thank you.
Okay.
Okay, did you want to go back to Miss Atkinson?
Yeah, this is what's here. and
Yeah.
Okay, Miss Atkinson, are you from Cushcone?
Yes, I'm here on behalf of my mom, Joy Kashabian, who owns the Cushcone.
Mhm. Okay, would you like to present to us your request?
Yes, as you know, she's a small business. I had written a letter to you all. I'm not sure if you got it. Been in operation 30 years, basically in operation for 5 to 6 months. Small family business, and we've relied on polystyrene as an effective and affordable packaging to keep our product at proper temperature, also to maintain a high quality of standards for our customers. You know, these have been the most practical options for serving ice cream, especially during warmer months. Transitioning immediately to an alternative packaging is going to present significant challenges for a business our size, concerns about our product performance, and also the ability so close to opening to be able to get a different packaging with higher supply costs. I think this will definitely have a meaningful financial impact on her with a short revenue window. But I also don't think that there's a problem to be committed to a reasonable, option for this as long as we're given time to explore other options. I know there's sustainable packaging options out there, but at this time we need to have some time to find them.
Okay. Anything else?
Oh, I think that pretty much sums it up. I mean, we do have a high percentage of stock in place for this upcoming year, as we usually do at the end of the season. And I know we acknowledge the fact, but I'll be honest with you, we just checked the box off, not even paying attention because it was trying to get the permits all set for opening year, and it was in November. So I apologize for not paying attention to that. So that's on our fault.
Okay, any questions?
When did this go into place?
Yeah,
When did I
April.
forget.
January
When
1st.
January
And in
1st.
November, for their renewals, there's a statement that it's in effect, and then they have to sign that they acknowledge the statement.
Mhm.
So.
And it's tiny. I mean, it's just a one thing. You acknowledge polystyrene. Well, honestly, we're closed at that time for the end of the season. So we're just trying to get all of our permits in place for December 1st when they were due.
Okay, so a couple of things to think about. One, conversations about this were happening when they were open. I do recognize they're seasonal, and they probably did not have the chance to utilize their inventory like other restaurants and food establishments were able to do. I do recognize that. I think my advice, I guess, would be to meet a compromise. I would not say you get the whole season to utilize.
No, I'm not looking for the whole season.
Okay.
Not at all.
Can I ask how, with the current inventory, how long, what is the current inventory of styrofoam and how long would that take you to go through?
It all depends on our weather. I mean,
Yeah.
I anticipate we're opening right around the 1st of April.
Oh, okay.
So, I mean, if it's 40 degrees, we're not going to utilize a lot of styrofoam cups. But if you say to me, look, by May 31st, it gives us time to order and not say, when the Board of Health comes in and says, oh, you can't use this and we're opening in 2 days, that's where I have an issue. But if you give me a time frame, I will easily work with that because that's what would have happened if I hadn't heard this in passing.
So Tim, I anticipate that if from the business perspective, if we said May 31st, if she's at May 1st or 2nd and realizes that she's gonna run out, she's not gonna reorder styrofoam to get through the month. Like it does seem to me that when you will not be ordering styrofoam, you'll just be using down what you have. Is that correct?
That's correct. And then
Yeah.
we will
Doesn't
now
make-
put in, find some reasonable packaging and put that into place as we're, if we come to May 31st and we still have styrofoam, we're certainly not going to use it. I mean, we believe in helping with the environment, and I understand this going into place. We just need a little more time to utilize some of ours and get some new packaging in there.
I have a few questions.
Yes.
Okay, so we actually put this, we passed this regulation, I guess, a year ago. So it's been out there
Oh, was
for
it
quite
a
some
year
time. We decided to allow it to, go on pause until January 1, 2026, so that everybody had time to utilize it. To use what they had, and to order new things. So it's not just an environmental issue. It's true that polystyrene cannot be recycled. It goes into the landfills. But if you read our regulation, you would also see that polystyrene containers do leach styrene into the food or beverages that you put into them. And styrene is known to be a cancer-causing chemical. So that's why we got worried. It wasn't just an environmental thing, it was actually a public health sort of thing. I did take the opportunity to look up what other things were available. And I found a lot of different companies actually that sell not only what they call foam containers, which is the polystyrene, but they also sell polyethylene coated paper containers, which, would not have the issue that the polystyrene does. They are a bit more expensive. The polystyrene, I think, was like $105 for a case.
I do think, I don't mean to interrupt you, Barry, but I do feel like I appreciate cost, but I also think, to your point, if it's a carcinogen, and I also, with all of the ice cream places in Plymouth, this is the only one that's having the issue, which is fine. I understand the seasonal everything, but I feel as if, there must be other options.
Okay, I will make a caveat that our other seasonal are not open. So
they might,
we don't know.
We don't know.
We honestly don't know. I mean, there are still some seasonals that have not come to us for an opening inspection yet. Cushstone is
Okay.
sort of ahead of the curve, perhaps a little bit.
And just to sort of piggyback also on what you were saying, it does leach into the food, but it has to sort of be there a while, and this ice cream just goes in and out
Yeah.
quickly.
Yeah.
Or be cooked in it, and that's of course bad too.
Yeah.
It's
Especially if it's a liquid containing sort of material that goes in.
Yeah,
It probably leaches in somewhat faster.
Melted ice cream.
yeah, melted ice cream.
Can I say something? When you started talking about this, was there a reason, or you say it was implemented back almost a year ago? Why weren't we sent a direct letter about it instead of getting just this little line item on our permit? Don't you think when you were discussing it, like we should have been notified? This is what we've decided will go into place on January 1st. I didn't know anything about this. I just happened to hear it from somebody who lives in the town. I don't live in the town. But as a business, as my mom is a business owner, we were not notified by a letter. And I don't think that's fair.
You were emailed. Yeah, when we were having open discussions and we had public forum about it, all the food establishments were emailed to let them know that this was happening.
I'd like to, if you say so, but I get our emails and I don't see them. So I just think this has caused an issue. So say we're not going to have paper in time for our opening date.
Right.
I Yeah, I do feel like it's fair to give a month, maybe two.
Yeah, a month or two
yeah.
at the maximum.
I don't think that's
I
a.
mean, we're
This
not
is-
asking for 6, believe
No.
me.
Yeah, it's not gonna change as much as I would like to not have this happen, it's not gonna change the world to give a business owner.
Yeah.
No, I agree. I think, because if we look at that, they're a 6 month, they're open for 6 months. If the weather is good, April 1st to,
Yeah.
end of September. I think that, April and May, that's 2 out of the 6. I think that's fair. That by June 1st,
Yeah.
you should have enough time to gather some other inventory, in the shop so that you could utilize non-styrene products.
And I'd like to also point out that being an ice cream fan, because I grew up in New England,
Uh-huh.
and it's one of our major food groups.
What was that,
I mean-
sir? I didn't hear you.
I'm an ice cream fan, and I grew up in New England, so it's one of my major food groups. I have been to Ziggy's and to Geller's quite a lot, and both of them no longer have not used the polystyrene for the past year.
So I, unless Katie has something to add, I would like to make a motion if that's.
Please do. Do you have anything to add, Kate?
No, I think you guys got it all.
Okay,
All right, so I'd like to make a motion to allow Fishcone to use polystyrene through May 31st and no longer afterwards.
And
second,
I will second it.
okay. So Amy has made the motion and Dr. Potvin has seconded. All in favor?
Aye.
Aye.
Okay,
And
you
just
have-
as an FYI, I am going to try to get some paper so that we're not using the polystyrene. I'm going to do my best.
Thank you.
Yeah, we
Just
appreciate it.
to, so that it doesn't cause any other issues with any other ice cream
Yeah.
establishments in the town.
And I look forward to my brownie sundae. We will be there soon.
Me too.
I'll let my mom know.
Okay.
Thank you so much.
It's like a
Yeah,
little neighborhood ice cream place.
I go there.
I said, oh, hi.
Yeah, they're right down the street.
I love their brownie sundaes.
Okay, so now we will talk to septic variance on 208 Manamet Point.
Well, that hasn't happened yet. That's coming back to me. That's going to you.
Yeah, where I kind of use the screen or?
Ladies, you guys a big one.
We've got this done. Yes.
Katie's not gonna be able to see, but we'll talk. We'll talk, so Katie can understand what we're doing. Yeah.
You probably pull the plan up on the screen at the same time. Good evening, everyone. My name is Chris Sanderson. I'm with Merrill Engineers and Land Surveyors, and I'm here tonight with Tim and David White, who recently purchased 208 Mammoth Point Road, back in the fall. So we've been in the process of design and permitting for a tear down and rebuild of an existing 4-bedroom, single-family home. I don't know if anybody got a chance to go out to the site or look it up. The home's in pretty rough shape. I don't think it has been lived in for several years at this point. So the wife purchased the property, kind of deemed that it was gonna be a full tear down rebuild. So what's being proposed is again, another single family home, 4 bedrooms, so no increase in use of the property. Looking over to this little caption here, this is the existing footprint of the dilapidated dwelling. And the proposed footprint is essentially going right back in that same footprint. It's a small lot, just over 5,000 square feet. About some residential properties to the east and west. Manamet Point Road here to the south, and then there is a coastal bank with a stone revetment down to White Horse Beach and Cape Cod Bay. So a lot of constraints on this one in terms of zoning setbacks that we're up against for a new house footprint, conservation setbacks from the resource area, which is the top of coastal bank. So that kind of locked us in where we're siting everything. Currently, the existing dwelling is a cesspool located in the backyard, which is less than 50 feet from the resource area. So we're proposing to abandon that, pump it, crush, fill, and abandon in place. And then we are proposing a new 4-bedroom septic system up to the front of the lot here. So this lot is kind of a walkout situation. The front driveway portion is up front, which is about equal to road level. And then the lot begins to drop off to a walkout in the back. So by keeping the system up in the front of the driveway, we not only push it as far away from the resource area as we possibly can, getting it almost outside the 100-foot buffer, which I made sure to point out to Concom, that was a goal of ours. So the 1,500-gallon tank, we're asking for a couple local upgrade approvals as far as setbacks go, due to, just the minimal area we're working with up there. We're 9.1 feet off the neighboring property line, 6.8 feet off the front property line of the street line, and then 4.3 feet off of the dwelling. The leaching field consists of 3 500-gallon chambers with stone surrounding. Kind of tried to come up with a configuration that best fit for a 4-bedroom septic. And a few of the variances we are asking for on that are 6.6 to the neighboring property line, 2.1 to the front street property line, and then 6.3 to the dwelling. Now with all those setback waivers, the form of mitigation we're proposing to kind of keep that septic system protected is to wrap an impermeable liner fully around the system where all those waivers are being requested. So that impervious barrier will basically be at the level of the top of the system in full depth down to the bottom of the foundation, kind of protecting the foundation, and there won't be any water penetrating through that. We're proposing to relocate the water line, which currently just goes straight to the dwelling around, and that portion will be sleeved anywhere that it's within 10 feet of the proposed system to protect that. The Whites have shared this plan with the 2 direct abutters, just kind of in preparation for all this planning and design work, and they didn't have any issues. I think that pretty much covers it. More than happy to answer any questions.
Is it? Sorry, is the driveway here, or?
So this is under the driveway, and everything proposed is H20 loading,
Okay.
which can be under pavement.
Yep, invented,
Yep.
okay.
And this is on town water.
Town
Town
water,
water.
yes, so no well setbacks, which is nice.
Sharon,
We
what-
generally encourage replacing cesspools
Yes,
every time we get a chance.
that's right.
My only other concern would be, is there any history of flooding since it's so close to the water?
No, we're
No, that's
well
on the bluff.
elevated outside the flood zone. This is the graphically plotted
Okay.
flood zone, but it actually has an elevation of 17 associated with it.
Okay.
So
Yeah.
it's really, kind of somewhere on this revetment here.
Yeah,
Okay.
it's
And
down pretty far.
Are there abutters?
We notified the abutters, and just kind of prior to this process, David did share with the 2 immediate abutters were seeking that little bit of relief from, just to keep them involved.
Yeah.
Are you the one?
We are.
Okay.
Okay, did you have anything you wanted to say? You just.
Chris, I think really covered it very well for us. I can answer questions.
Good. So, what
Just
does
one
the
quick
department
question.
think?
You send out a certified, even though you had a conversation, so it's a certified letter sent to the abutters?
Yep, with the plan, and I sent the slips to Dana. so
Yeah, I don't have those, so we'll have to check.
I can
those.
run some tomorrow.
Okay,
Meant to bring back.
alright, that's the only question I had, that with that, we would approve.
You would approve?
Yeah.
Okay. Any other questions? Kate, do you have any questions?
Nope.
Okay, so let's take a vote. Oh, actually,
I'll make a motion to accept the plan as written.
okay, second.
Second the motion.
Okay, Amy makes the motion and Dr. Potvin second. And all in favor?
Aye.
Aye.
Chris, we do have this.
We have them,
It's
Oh,
yeah, thank you,
Thanks, guys.
passed.
thank you.
Very much.
That's a nice,
Thank you.
that's a
Good luck.
nice place up there.
Yeah.
I live in
Yeah.
that area.
It's a
Yeah.
tight spot.
Yeah, it is.
You can go to Cushcomb too.
Yeah.
I have the brownie Sundays to die for.
Yes. Or Gallup. That's equal time. Okay, very good. So, this, month is, colon cancer awareness. Could you put my slides up? Sure. Me? Yeah. So March is, colorectal cancer awareness.
Thanks.
Fine.
I'll leave this.
Yeah,
when you're done.
that's fine. So, just next slide. Just to give you some statistics, which really should have people think about this much more seriously than I think we do. Colorectal cancer is the second leading cause of cancer in both male and female, so the combined gender in the United States. And when you look at the estimated number of new cases and the projected number of deaths, you can see that this affects a lot of people. It used to be a thing where we worried about it in older adults, and that was why when you reached a certain age, you had to have a evaluation, and nobody wanted to do it, but that was what they did. And the interesting thing is that now the rates are rising. They're rising as high as almost 3% in adults under 50. So, that now accounts for 1 in 5 diagnoses.
Do you know the youngest age where this has become a problem?
I didn't see
I
anything
think it's pretty.
of that, but I know it's, they're talking about millennials and, people like that. So probably in their 20s.
Yeah.
Yeah. I
So
know it.
have they changed the recommendation for starting colonoscopies?
No.
I think
They-
it's 45.
Well, it's 45. It used to be
50.
50, yeah. So not
that
really.
young.
Yeah, not that young. So the risk factors you can see here, they're saying 50 plus, but it's increasing in millennials and Gen Zs. The other things that are risk factors are highly processed meats and red meats, obesity, physical inactivity, smoking, heavy alcohol use, a history of colorectal cancer, both in yourself and in your family, and personal history of polyps if you've ever had a problem before, inflammatory bowel disease, and then, as I mentioned, the genetic risk factors. So you can see that a lot of these risk factors are things that we talk about all the time with other issues that we can have, but that certainly is something to pay attention to. So what are the signs and symptoms? And we ourselves are the ones that are going to see these. So we need to be aware of them and not just ignore them when they start happening. Sometimes it's difficult to talk about these things, especially about having stools and, diarrhea, constipation. People don't want to talk about that. But if you have any change in your bowel habits like that, if you have any bleeding, if you see blood in your stool, or you see it on your toilet paper when you wipe, ongoing discomfort in the belly area, such as cramps, gas, or pain, don't just think, oh, it's something I ate, or, I'm allergic to that food. If you're seeing it ongoing, then that could be a problem. Feeling that the bowel doesn't empty all the way. So if you're paying attention, you can tell if you sort of feel constipated that it's not all coming out. And then just generally weak, feeling tired, and losing weight without trying. People always like that. They're happy about it, but it's not a good thing. Oh, you can go on to the next one. So, oops, wait. There should be one before that.
The rest, you don't.
Yeah,
Oh, there you go.
that
Sorry about that.
one. Screening. So how do they screen for it? So just so that you're not scared to bring it up to people, you need to realize that there are some screening tests that are not quite as invasive. The gold standard is the colonoscopy. They look at the entire rectum and colon. That's the one that everyone goes, yeah. I see the look on your face. That's why people don't want to talk about it. But there are some lesser invasive tests that can be screening and pre-screening. There's a stool test that just actually looks for blood in your stool. So you just take a little sample of it and smear it on a card, and then it can get tested. So that's not invasive. That's very private. The new test that everyone sees about now is called Cologuard. Cologuard is actually a DNA test that looks for the cancer in your stool. And then there are blood tests that can also look at that. Now, Cologuard is, again, a screening test, and there can be some false negatives, there can be some false positives. But it does at least get you a place to start. And then the other things are, again, more invasive, the Flex Sig, which just looks at the lower part of your colon, so it doesn't go through the whole intestine. And then a CT that also looks at the colon. And, anytime you have these tests, you have to realize that there are going to be, possibly be some false positives and false negatives. And if you get these tests and you feel that you're not getting the information that you need from your doctor, that the doctor isn't paying as close attention to you as you would like, I just want to advocate for everyone to not be afraid to get a second opinion, because this can happen. People can get false positives and false negatives. So it's when it comes to your health, don't worry about that. The good news is that the overall survival rate for people with colon cancer is about 65% if it's caught early enough. Okay, but 91% survival rate earlier. Earlier you go, the more localized your cancer is going to be. It's going to be easy to just take out a small portion of your bowel and not the whole thing. It really is something that is important. So we've all probably had experiences where maybe somebody in the family has polyps, or has to get tested more regularly than they recommend because of something that happened in the past. But I would say not worry about it. Now, Margaret, you had a friend who, how old was she?
So Lorna Brunel was actually with us tonight.
Oh, very good.
I've actually known Lorna since I was in high school, and she's only very close to my age.
Well then.
But Lorna has always been, she is a cancer survivor. And she's had a lot of experience dealing with it, being an advocate for both herself and her family. She's very vocal about her experience. And so I just thought she was the perfect person to speak to us all tonight about the importance of early screening and for advocacy. So Lorna, take it away.
Thank you so much for having me. Can everyone hear me okay?
Yeah.
Yes,
Okay, great. So I love that you mentioned Cologuard because that's really where I wanted to start tonight. I turned 50 during the pandemic. I'm 54 years old. I'm 55 years old now. And I turned 50 during 2020. And they were pausing colonoscopies at the time, unless you had like a real strong family history. And they were so backed up after that because they really took almost like a solid year off of just regular testing. So I went into my physical and I thought, you know what, my mom died of breast cancer when she was very young. So I've taken screening seriously my entire life, all the screenings. I had thyroid cancer when I was 33. So I'm always saying, don't skip the neck check. Don't skip the mammograms, don't skip colonoscopies. And here I am as an advocate. I was an actual patient advocate in Boston years ago for a while. And yet I couldn't get a colonoscopy scheduled. So in 2021, they said it was still very, very hard to get an appointment. 2022, same story. 2023, same story. So finally in 2024, I put my foot down and I said, even though I don't have a family history, I feel very uncomfortable I guess I was actually 53 and not having a colonoscopy. It was definitely in 2024. So I was 53. I said, I think it's time. I'm 3 years off schedule because back then it was really like 50 years old was the screening baseline. So they prescribed a Cologuard kit for me because I didn't have a family history and I didn't have any symptoms. And it's also worth noting that same year I had lost 100 pounds the old fashioned way with exercise and keto. And I felt like I was the healthiest I had been in years. So I did it just for peace of mind. I didn't do it because I had symptoms. So from there, they sent the Cologuard kit to my house. And within 5 or 6 days, I got an email from Cologuard saying that it was positive for, something was off, right? And it was a high percentage. It was like 98% positive for something. So I panicked and I called the PCP and said, this is positive. I need to have a colonoscopy. And the PCP said, you know what? They're so unreliable and there are so many false positives. I think it's okay for you to let this go and we can discuss it again next year. I was also slated for a trip to Ireland that summer for my sister's 50th. The trip was already completely paid for. And the PCP knew that. And the PCP said, just go have your trip to Ireland. Everything, seems fine. We have so many false positives. I wouldn't really worry about it. And then I pushed and said, I can't ignore something that came back positive. I have to go the next step. And then the office said, well, good luck having your insurance pay for the colonoscopy because insurance just paid for the Cologuard. So I took matters into my own hands, called my insurance company, explained the situation. I said, we're at the point now where there's been a finding. So I need to have further testing. They ended up begrudgingly paying for the colonoscopy. So when you said the word advocate earlier, that struck something with me because if I had listened to the PCP and gone to Ireland and taken an entire year off from testing, and if I had allowed the insurance company to bully me into thinking that I had to pay out of pocket for the colonoscopy, chances are if I had been in somebody else's shoes, I wouldn't have moved forward. So I really am sharing this story to remind people that you have to follow your gut instinct and just keep going. And if you need help, then get an advocate to help you. So I went to the colonoscopy in Plymouth at Beth Israel, and they said, when you wake up, you'll either be wheeled out to your husband in the parking lot, or if something is going on, we will be in the room with you. And I woke up from the colonoscopy with 2 doctors on my right and my husband on my left. And, it was a bummer for me in many ways because everyone talked about that propofol feeling like the best sleep of your life and how it was just like the most relaxing, deep sleep. And then for the rest of the day, you feel wonderful. And I woke up to, here we go again. It wasn't my first time at the rodeo. I had cancer 20 years prior when I had thyroid cancer. So I just very respectfully said, it's not my first time. Please forward everything to my team in Boston and I'll work it out from there. And from there, I went to Mass General for an opinion. And then I went to Dana-Farber for a second opinion and I landed at Dana-Farber. I had 2 surgeries. The first surgery was to remove the scar tissue that was left behind after 6 infusions of chemotherapy. So it was 6 infusions of chemo, first surgery. The scar tissue was really like beautifully just taken care of by the chemo. The tumor was just gone. And it was a very small tumor. It was about the size of a strawberry that somebody had stepped on the sidewalk. So it was a flat tumor the size of a strawberry. And because of that, I didn't have typical symptoms. My stool hadn't changed shape. I wasn't suffering from side effects where a tumor would be blocking your stool. So I didn't have a lot of constipation. I didn't have a lot of bleeding. I didn't have anything that normally you would look for because it was a flat tumor. So I think that's important too. When people say to themselves, well, I didn't have any of the symptoms. I repeat, I didn't have any symptoms. So after the first surgery, I went home with an ileostomy bag, which gives your body time to heal because they've removed section of the rectum, section of the colon in my case, and everything was put back together again and needed time to heal. I went home on a bag. And I worked all through chemo through the first half. But then my second half of chemo, which is it's very common to have a break in the middle. It's usually chemo, surgery, however it goes for you. When I went through the second half of chemo, it was right during our flu A, RSV, COVID. This was, it was a big thing. Everyone was getting sick. So I worked from home. I did very, very well on chemo. And then I had the second surgery to remove the ileostomy bag on my birthday last year, February 6th. And I thought it was the coolest birthday because I was just walking into my brand new life. The bag was being removed. I was essentially finished with all things surgery. And I just had to button up this cleanup chemo, which is what we call when the tumor's been removed, the margins have been cleared, and everything looks great. So I decided to finish up the chemo and I did the final 6. In the middle of that ride, I had a bilateral, very serious pulmonary embolism and was taken by ambulance back to Beth Israel in Plymouth. No idea what was going on. That could even be a topic for another day. But that was a classic storm with chemo, cancer, and surgery. So clots happen, even though I took the measures to prevent them by putting the Lovenox injections in my belly for several days. After the bilateral pulmonary embolism, I came home. I concluded chemo on May 17th and just went right back about my business. I went right back to work and started hitting the road like running, talking about screening, using my social media platforms as a way to shout from the rooftops to everybody. As far as colonoscopy prep, I had nightmares about this, right? Oh, thank you for changing my name. Hi. I'd always heard like, oh, you get so dehydrated and you're so weak and it's so dangerous and you can faint and all these things. And honestly, it couldn't be any further from the truth. I followed the protocol. I was drinking the broth and eating the Jello, and you just block the day off. And one of my favorite lines from The Devil Wears Prada is, I'm one stomach virus away from my goal weight. So I was like, hey, who doesn't want to lose 5 pounds? This is great. And that wasn't a problem. And I've done that twice because I just had a repeat colonoscopy in November to make sure everything's okay. And, the whole time I was posting on social media, here's my Gatorade, here's my Jello, here's my broth. This is nothing to be afraid of. You can handle this. So to me, being completely transparent is important because I want to, pull back the veil on something that seems scary or taboo or, a topic that people aren't talking about just because it's embarrassing. And for me, we can't afford to not talk about it because, as you said earlier, the statistics are staggering, hitting ages 25 to 45 at an alarming rate. We definitely, in my opinion, need to lower the screening age from 45 now that the data is proving to us that young people are being impacted by this. And I think we need to give Cologuard more street cred and make sure that people have faith in Cologuard testing and make sure that they can have that opportunity to test at home. I'm happy to answer any questions, but I know with respect to time, I don't want to go on and on and on if we have other people who need their time.
Thank you for that.
Yes, thank you, Lorna. That was really great. And you are such a good advocate and role model for people to be advocates for
Thank you.
themselves.
Yeah.
Thanks.
Because we really need to advocate for ourselves.
Mhm.
And, you know, people think they go to the doctor and the doctor's then gonna take care of it all. And not, you know, I'm
Yeah.
a doctor myself, so I,
Yeah.
I try to,
Yeah.
but,
And so,
but-
if I may, the whole reason why I had to do chemotherapy is because the tumor that I had, albeit flat and very small, had already made its way into the lining of the abdominal
Lining.
wall.
Yeah.
So if I had
It's
gone to Ireland
deep.
and taken that year, it would have just continued to seep into other parts of my body, and that would have been a much different scenario.
Yes,
So,
yeah.
and because it was so small and so early, I mean, I was diagnosed stage 2A, you know, I was able to knock it out with chemotherapy and then, you know,
Yes.
clear those margins so beautifully. And I'm available here to answer any questions, to help anybody sort of, you know, process a timeline, if you will. It was about a year from diagnosis to finish. So 2024, on June 19th, 2024, I was diagnosed, and I finished chemotherapy on May 17th, 2025. So it was almost exactly 1 year, but I worked through the whole first half of it, and I would have continued working if not that. You know, I work in a very crowded theater environment, and I also work with children quite a bit, and everyone was getting very sick. So because my immune system was compromised, I worked from home, but I know plenty of people who have been in chemotherapy who have still gone to work. I found it to be, knock on wood, very manageable. And I think it's all about positive mindset and the attitude. I would say on my Dana-Farber days, in general, just as a medical advocate, and I've written a few books on cancer, it's all mindset. So I would go to chemo in very brightly colored clothing with trays of homemade cookies and fresh flowers for the oncology nurses and doctors, and daffodils and tulips and sweets and chocolate. And you know, I became known as the girl that would pass the phone around and everyone would buy my dress on Amazon or different sites. And they'd say, "Oh my gosh, it has pockets and it's so bright. You look like sunshine." And I would say, "Oh, I'm not at chemotherapy tomorrow. I'm going to Newbury Street to have a vitamin 12 infusion." That's what I kept saying. It's just a bit of a little vitamin infusion. It's nothing intense. And I would say that to myself. This chemotherapy infusion is vitamins. It's making me strong. And I feel like mindset is something that we need to think about too, because the mindset will get you to the point where you'll schedule the colonoscopy. The mindset will get you to the point where you're going to ask for the Cologuard. I think it's important to just have the mindset of prevention. You know, I'm worth it. And I know that my life matters and my body matters. And it's important to me to take advantage of what's afforded to us in one of the best places in the country for medical care.
Yeah.
Yeah.
Thank you. Thank you very much. Anybody have any questions?
Yeah, I still remember my birthday gift when I turned 50. My doctor said, "Happy birthday, I'm gonna schedule your colonoscopy immediately."
Yeah.
And then finally, the Cologuard came out, and I asked the different doctor now.
Yeah.
I said, "Well, what about that?" He said, "Well, just understand that if it comes out positive, you have to have a colonoscopy
Anyway.
anyway, and insurance won't pay for it."
Yeah.
Congratulations with winning the battle with the
Yeah,
insurance
yeah,
company.
good.
Yeah,
There's no reason.
Yeah.
it just doesn't make sense, you know. And also thank you for sharing that. I think sharing is really important. Since I've gone on social media to talk about this, I have over 150 emails from men and women who have scheduled colonoscopies because of the stories that I've shared. And of those 150 or more, 4 or 5 of them have actually had positive findings at a very early stage. So just by talking about this, we can encourage people to, you know, to pick up the phone and make that appointment. So thank you for that.
Yes.
Yeah. And
I
I
al-
think
Good.
because of my family history, I've been getting them since I was 35, and like, yeah, those of us that have had it know
Just do.
Oh, yeah.
it's super easy.
Super
Yeah.
easy.
spend a day at home and Luana's line is also one of my favorites.
Yeah.
The prep is the worst part.
Well,
You know?
That's definitely not what I thought, like the way people, I feel like it's.
Well, it's changed.
Yeah.
Yeah, I think it's very different now.
You know, I definitely feel like it's a rite of passage, you know, you go through it, you talk, you exchange war stories, you.
Right. And also, if I
What?
may, there are still some clinics and hospitals that are sending you home with the big drink. And this is another area where you may advocate. What I love about Beth Israel in Plymouth is it's much more civilized. It's usually just, two little pills and a mag sit,
yeah, that's easy to
it's
do.
so much easier. So advocate that way too. Anyone who's listening, if you see that big jug coming your way where you're supposed to have ounces and ounces of that chalky, yucky drink, just say, is it possible for us to talk about using magnesium citrate? Is it possible for me to talk about using, Docalax pills with the citrate? And then the other thing that I would ask that you can advocate for is the time frame. Sometimes you're getting out of bed at 3:00 in the morning to take your next drink and on and on and on. Just be very honest and open with your team and say, I want to get the best out of this and I want to do my best with this. Is it possible that we push back the time, or however it is, as long as when you show up, you are ready for the prep has been completed. I didn't do the big, huge drink of the chalky stuff. I used mag citrate twice and it was easy breezy. I just put it on ice and, pretended I was on an island somewhere.
Yeah, I still remember the face on my dad.
Thank you so much. I'm so grateful to you and
Yeah.
everything that you had to say tonight. I really appreciate you taking the time.
Thank you.
Thank you for having me. Be well,
Alrighty.
everyone. Take
Thank
care.
you.
Thank you.
Thank you.
Bye.
I still remember
I-
the face on the gastroenterologist, my first colonoscopy.
Yeah,
I was getting ready to be taken in for it. And I said, can you just give me a light sedative so I can watch the video?
oh, God.
No, thanks.
Well, let's move along.
Okay, so, actually, this is a good segue into, another guest that we have, Dr. Tricarton, I don't know exactly how to pronounce your name. You are there, and, this is, the Chief Medical Officer for Beth Israel, Deaconess in Plymouth, and we're glad to welcome you. You got some kudos there from Lorna, so that was good.
Yep.
And we would like to know what's going on at Beth Israel these days.
Yeah, thank you. And thank you to the Board of Health for inviting me. Ms. Marini, has spoken highly of the body, and, we've been talking about how to, basically improve the collaboration between the town and the hospital. I've also been meeting regularly with Ms. Brody, the Commissioner of Health and Human Services, and we talked about, sort of coming to the board and talking about what's going on at the hospital. So, our thoughts were to talk about some of the initiatives that are going on at the hospital for now, and then how that might, pair with things that the Board of Health is working on. And, no specific ideas at this point or asks of the board right now, but, thought meeting everyone and sort of opening the conversation and, seeing how things go from there might benefit both of us. So if that sounds reasonable, I just have a few slides on sort of some things that are going on in the hospital, and I can talk about those if you'd like.
Yeah, did you want to share them or would you like us to?
Sure, I can share them.
Okay, great, thank you.
I've got them right here. I think you're seeing them. Is that
Yeah.
correct? All right.
We can see.
All right. So, I wanted to sort of update folks because we get a lot of questions on what's the difference between Beth Israel Lahey Health and Beth Israel Deaconess Plymouth. So this is a map, obviously, of Eastern Massachusetts and shows all the different hospitals that are now part of Beth Israel Lahey Health. So as folks may know, as of a few years ago, BID Plymouth was Jordan Hospital. Merged with Beth Israel Deaconess System and became Beth Israel Deaconess hospital in Plymouth. And that sort of was the system that it's, down in the southern area, south of Boston. And then just about 5 years ago at this point, Beth Israel Deaconess system merged with the Leahy system and we became BILH. And the reason I mention this is, this system merger has really offered us the ability to really expand the number of services that are available here in Plymouth. When I started as an ER doctor, at Plymouth in 2017, the number of things that we could do locally, was really limited. And we had to transfer a lot of patients up into Boston for additional services. And now when I see patients in the ER, very few need to go into Boston because we can offer almost everything right here in the, locally, which means less time spent, on Route 3 and 93. So I think it's really offered a lot of opportunity for Plymouth residents. Um, and, this is our Blueprint 2030 plan, which really boils down to a goal of 70% of the care being delivered in the community. A lot of larger health systems sort of merge with the idea of just trying to draw care into the big, large academic medical centers in the city. But that's not Beth Israel's strategic plan. We really want to drive as much of the care as possible out towards the local communities where folks can get care right next to them. And what that means is really expanding the capabilities, the services, and the clinicians that are available to local residents. And we're not going to talk about each of these folks here, but these are new providers that have come into the Plymouth area as part of BI Leahy to offer additional services. So we're talking about a ton of primary care doctors, things like endocrinology, more and more orthopedic surgery, cardiology, and we're planning on additional recruitment in the areas of gastroenterology, as the prior speaker was talking about, OBGYN, oncology, we're going to talk about a little bit more. And then, like I said, we're still even expanding our primary care because we continue to hear that folks have trouble accessing primary care. I'll stop there for a moment and just see if anybody has any questions or thoughts so far.
No.
Okay. So first up, people have probably seen and been aware of, our emergency department being a little too small, designed for, a town of Plymouth that was a lot smaller at the time. And so we're currently expanding our emergency department. Very soon we should be opening a new area, which, this is sort of an artist rendering of what it will look like from the outside. And then renovating, in place over time, the current emergency department. So some statistics about our existing ER versus what it will look like expanded. So the existing department was built in 1993, designed for 27,000 annual visits. We're currently seeing over 40,000 visits in that space right now. We only have 25 dedicated treatment spaces, 5 private rooms, 4 cubicles, and then 26 curtained bays. And then only 7 secure holding behavioral health beds. The expanded ER is forecasted to be complete in totality in the autumn of 2028, though, like I said, we're going to get new spaces available over time, and then be renovating in place. So we'll get, updated beds with more private rooms as time goes on. And this will be designed for 65,000 visits each year. And then with that, we'll have 37 private treatment rooms and 16 secure holding behavioral health rooms. And so, what this really says to me is better patient experience. You can imagine a private treatment room is a lot quieter, more private in terms of, keeping your health information private compared with a curtained bay or hallway beds, as well as infection control. Like we learned in the COVID pandemic, being able to close the room, offers a lot more flexibility to us when, we have respiratory illnesses going around. So how will patients benefit? We kind of talked about a little bit of this, but I think it's probably intuitive to most people that if we have more rooms, more space to take care of patients, there should be less waiting. We have the designed behavioral health unit, which will, help us take care of those patients better and more privately. And then, just more private, confidential, and family-friendly environments. And these are some renderings of the behavioral health and waiting room. And here's a picture of what the new exam rooms will look like. We actually had a lot of our ER staff members. I'm sorry?
Oh, I'm sorry. We were just saying how nice the rooms look, and I said,
Yeah.
I hope I never see it.
I know, exactly. I always say that when I see patients in the ER and I'm
That's funny.
sending them home. I say it was a pleasure to meet you, but I hope to never see you again.
Yes,
So you can see lots of natural light, chairs that store on the wall for visitors. And we actually, had a ton of employees from lots of different disciplines, departments in the hospital, and even patients come through a mock-up of this room and leave their comments using post-it notes or online surveys. And I think it really improved, a lot of the small details of the room that'll make it easier for staff and patients, and more enjoyable. So this is the existing ER plan. So it's that area in the blue. The orange area is the behavioral health unit currently. And then the pink unit is an area that we renovated during COVID. It was previously our breast center where we took care of patients getting evaluated and treated for breast cancer. And now it's been ER rooms, overflow space essentially for some time. The area between the pink and blue and orange is that's gray. That's our current CT scans, which the plan is actually not to move those because it's very resource intensive to do that and would add significantly to the cost and time for the project. So those areas will stay in place. But you can see, 50 total beds, but 15 of them are hallway beds and 16 are curtain bays, and 14,000 square foot within our current main emergency department. The new ER, almost double for the ED, and we continue to use that zone C as we call it, which is in pink. Gain the new orange area for behavioral health beds. And then by the end of it, have all of these areas renovated with 37 private rooms, no curtained bays, no hallway beds, and the vastly expanded behavioral health capabilities. So we're really excited about this. Most of the funds for this have come because of that Beth Israel Lahey Health system, collaboration. So we really wouldn't be able to do this without BIOH. So I'll stop there. That's kind of everything on the ER expansion. We're really excited, myself included, given I'm the ER doctor.
Yeah, that's great.
Yeah. Thank you for all that information.
Thank you.
That's very impressive.
Yeah.
I would like to mention to you that we look forward to further interactions because we
Yeah.
do have a public health excellence grant program that
Okay.
actually serves 4 of the hospital's service areas out of the 6 that are part of our program. And we need to work with you and try to make sure we coordinate our efforts.
Absolutely. Yeah. Yeah, and I can touch briefly too on our medical oncology. So we're moving oncology off-site to make room for that new ER, and we're going to double the square footage. It will be part of BIDMC rather than BID Plymouth, but and because of that, we'll be able to offer additional drugs and treatments that we couldn't do as Plymouth. And then the last thing is scheduled for tomorrow, but you never know what happens in the medical world, but we'll be starting robotic surgery tomorrow at BI Plymouth. So a couple of new overall initiatives, but I agree with you. I think, we're probably stronger together rather than alone. So I look forward to collaborating.
Yeah, that's great.
You mentioned cardiology.
Mhm.
And I'm curious, do you have like cath labs and, okay, places like that?
Yeah. So we have a cardiac cath lab. We can do, I think I heard that you're a physician, some
Yeah.
physicians in the room. So we have a STEMI program, so we can see people with acute heart attack. We can do some electrophysiology, things like pacemakers. We have some recent hires within that area that we're hoping we can expand even further what we can do in the cath lab.
Great. That's great. Yeah, because, the population of Plymouth is getting older. And
Yep.
so people will want to know those things, for sure.
Yeah, for sure. Yeah, cardiology, interventional radiology, we're expanding some of the procedures we can do in those areas, which are minimally invasive, which are really exciting. So lots to come for Plymouth in the future.
Mhm.
And you were definitely right about difficulty getting appointments with primary care physicians.
Yeah.
Desperately, this area needs, the whole area needs more primary care physicians. There's just not enough down here.
Agreed. Yeah.
Yeah.
It's a national problem that we're definitely feeling locally. Mhm.
Yeah.
That's-
Any other questions or?
No, this is
Thank
great.
you.
Thank you.
Comments? Yes,
Thanks for
thank you.
having me.
And
Yep.
we would love to use you as a resource
For sure.
as well for maybe speakers. We like to have people come and do some education, as you saw here with the cancer, the colon cancer issue. So we'd certainly like to tap into your people that way. If we
Yes,
could
absolutely. Yeah, I think
recommend-
that would be one of the main things that I can offer is, I pretty much know, somebody within any specialty that might be necessary for education.
Yes,
I went to the Duxbury Board of Health meeting a couple of weeks ago, and there was a constituent who was very concerned about e-bike safety. So
yes.
that board and myself worked together on a e-bike safety article, which we submitted to the Duxbury paper. So, things like that, I think we could all, certainly work together on.
Yeah, that would be great.
Mhm.
Good.
Thank you.
Well, thank you
Thank
for
you.
taking your time. I know,
Yeah,
I
thank
know it's busy.
Yep,
But we really
but that's
appreciate
great. Yeah. And I think you guys have my email, my contact information, and Katie certainly
Yes.
does as well. So,
We will use it. We'll be calling you.
all right. Thank you.
Thank you.
Bye.
Hi.
Okay, very good. So we're getting a little late, so I'm
Yeah.
going to take the updates portion and maybe put it to the
Okay.
next agenda.
Okay.
I should
Unless
just mention,
anyone
I
has
should
an
just mention
update
that
that they
the
really,
next handicap meeting is on Monday evening in the Great Hall. And the Nuclear Regulatory Commission will be present to give a talk. If anybody is
Yeah.
interested.
Yeah.
yeah,
good to know.
that is good to know. Okay, very good. And then there's also the workshop is going to be coming up before our next
The
the
MAHB.
MAHB workshop
Yes,
will be
that's-
coming up before
yep.
the next meeting, so
Yep.
that will be interesting as well. And I have a number of interesting updates from the wellness group that I was at today, but they can wait, but I'm very excited to share them with you. It's such a good group and there's so much going on in this town.
Yeah, there is.
I mean, we have good people that are really
Mhm.
focusing on good
Yeah.
ideas. So one question I had for you, Kate, because we'll talk about the kratom regulations next time. can we make sure and have the draft sent to all of us for that next meeting?
I thought the draft was being put into a Word doc and then was going to town council.
Yeah, it was.
Okay, so
Going
you
to
were
town
okay with it. Okay, so we can go ahead and send that to town council next. That'll be our next step then.
Okay,
Yeah, and I can get that out tomorrow. That's no
okay,
problem.
and then we can talk about it the next time.
Sure.
Yeah.
Okay,
I do want to talk about it next time though, because summer's coming and all these college kids are going to come home. So I feel like we need to hurry up and move on this.
yes, I totally agree, and it shouldn't take too long, but yeah. Okay, very good. Director's report.
Yes, I have two very timely things that I need to talk to folks about. The first one what's the first one that's gonna pop up, do you know?
And I, no. We're going to start talking about what you want to talk about.
Okay, so the first one is, Amy's very familiar with this, but, public health, the State Action for Public Health Excellence, SAFE 2.0, is sending out a survey. It's a, workforce standards survey, and they're asking, it should be completed by all health department staff, contractors, other municipal staff whose work supports the health department, regional staff, and why I'm bringing it tonight, Board of Health members.
Yeah.
Now, you only take it once, Amy, so I guess you're gonna have to decide what path you're going to
Done.
take. Okay, done. So I actually have it here just to give you an idea of what it's, I'll be sending an email tomorrow to the members of the board. Kind of just a little brief discussion about what it is while we're doing it, just to give you an idea tonight what it looks like. It's very simple. It's a lot of checking boxes. And then it shouldn't take you very long to do. I think when I did it, it took not very long.
Yeah, there's this one and then there's the performance standard one
Right.
that takes forever.
Right, but I don't think the board does that one.
No, they
That's-
don't.
Yeah,
That's
okay.
why I'm like, this is
Yeah.
nothing.
Okay,
compared to that one.
Right, so this is what the board will be doing. I'll be doing the performance standards for the
Yeah.
town of Plymouth, which will be very different, but we're asking for input from the board to do this one. And I've also shared it with other folks too, like it's interesting, like HR,
Yeah,
our finance person, like anyone who supports public health, you know what I mean? So, anyway, I'll be sending out the email tomorrow, so you only take it once. So for some reason you get it again from some other entity, please only take it once.
So the link will be in your email.
Yes, yep. Then, the second,
Guiding principle.
oh, yes.
Yeah, we saw that today.
yep.
Oh, yes. So, not that I really believe we have had an issue here with this board, but it is becoming an issue with many boards. That the interaction between board members and our residents is not where it should be. To the point where the select board has made a decision that this will be sent out to everyone who's a member of a board or committee, and you have to sign that you read it. Before you were given it when you became a member of a board or a committee, but now we really want to say that you've acknowledged that you have received it and that it exists. So I just want to kind of bring that up to your attention too, in case you get it in an email, saying that we want everyone to take a look at it again and then sign that you agree with what the principles are, which I think we do follow here. So
I like this board.
yeah, I don't, but I have watched others and I can see why the select board is concerned about this. Do you know what I mean? I've watched a lot of other meetings where it's not that way.
Yeah.
You know, so I know why this is important to them and why they're doing it. So,
I appreciate that.
so those are the two things I just wanted to kind of talk about tonight. So that's it for me.
Good. And then I wanted to mention under new business, there have been reported 2 cases of measles in Massachusetts. And they have occurred in 1 child and 1 adult. They did not contract it. It appears that they did not contract the measles here in Massachusetts. They attracted them or got them elsewhere. They were on vacations and trips and things like that. So, but just to let you know that, measles is highly contagious. And if you're around anybody that has it, you need to be very careful. The measles rash, just so that you know, because the rash is quite distinct. If your child or you start to develop a rash, measles rash starts at your head, on your face, and it moves down your body. So that's very classic, and then it fades in the same way. So if you have a child that has rash up here in the face of the head, and then it moves, and then it's down here, and then it's down on the legs, that's your clue. But hopefully we don't get any more in Massachusetts. Okay, and that's all I have, unless you want to add anything more about the measles.
Yeah, we'll be keeping an eye on that.
Yeah.
And next meeting date is.
Yeah, the next meeting date is the
April 1st.
April Fool's Day.
Yeah.
And that will be virtual.
Yes.
And yes, so if anyone has any disagreement, I need
I will
a
make a
motion
motion to
to
adjourn.
adjourn.
I will second the motion to.
Okay, and all in favor?
Aye.
Aye.